Well, good morning.
Good morning.
Well, today we're doing a short little video to try to help some of you out there who have had problems with substance abuse and find yourself pregnant. Now, there's no good data on Subutex or Suboxone in pregnancy, so this is by no means a definitive video. It's just one example of what can happen. And we happen to have a good outcome, but it could have just as well been a negative outcome. So, you came to me and you've been doing what drugs?
Heroin.
You've been doing heroin. Okay, so, and you were how much pregnant when we started?
Gosh, 5 months.
About 5 months. And so when she came to me, she's on heroin, she's 5 months, she wants to get off the heroin, so we try to figure out, okay, where do we start? And what kind of regimen can we put her on to come off of this heroin as fast as she can, but by the same time not send her into problems, not have problems with the baby. So we had to come up with a weaning course that would be appropriate for her and one that she could handle and not have withdrawal symptoms. So what did we do?
We started 8.
We started 8 milligrams of Subutex.
Right.
Not Suboxone.
Right.
Of Subutex. And so how long did we stay there?
We had a plan, but I failed the plan.
Okay, so she was ambitious when she came in. She had a plan and we were going to try to wean off by the time of delivery. But she didn't make it that far. And that's an example to you that most times when you're on Suboxone, Subutex, you cannot wean fast. You have to wean slow because the receptors are there and they shrink very slowly. So we had a plan to wean fast. So by the time of delivery, we were down to what?
6.
We were down to 6 at the time of delivery, which was not a fast wean, kind of a slow one, but maybe even a little faster than I normally would go. I normally take about 3 months at each dosage. So we delivered at 6 and delivery went?
Amazing.
Okay.
Perfect.
And the baby didn't have to get any drugs?
Nothing.
Okay. Didn't have to be detoxed?
Nope.
Okay.
Nothing at all.
And right now the baby looks like he's doing wonderful.
Yeah.
And mommy's doing wonderful.
Doing
and
good.
So you're how much out of delivery right now?
A week and 3 days.
Week and 3 days. And doing good?
Doing great.
So you took a brief amount of Percocet with the C-section, right? And now you can't wait to get back on Subutex. I keep saying Suboxone, but Subutex. So just a brief little history, brief little story of one good example, one positive outcome for somebody being on Subutex while pregnant. By no means is this a definitive video, is this a definitive anything. It's just one example of what could possibly happen. So on that note, I want all of you to be blessed and have a wonderful day.